Irreverent, entertaining, cool. You're listening to LA Talk Radio.
You're listening to The Inner Voice with Dr. Foojan Zeine, only on LA Talk Radio.
Hello, everyone. Welcome to the Inner Voice Show. I'm Dr. Foojan Zeine, and it's great to be with all of you who are listening today. This show is about you, about what matters most in your life. I speak with experts in the field of human sciences and receive the jewel of their knowledge and bring it to you. I feel honored that I have access to many of great psychologists and scientists who I meet, and I have the opportunity to bring them to you. And for all of us to learn, I always have the chance to learn from everyone who comes on the show. And today I'm so excited to have Dr. Scott Miller, who's the founder of the International Center for Clinical Excellence, with us. I've always learned a lot from him. We're going to go to some other conversations and be right back. Usually I have research that I talk about right now, the latest research that comes in, but I didn't do that today. Why? Because Dr. Miller talks about research. This is what he does. He researches constantly, so I wanted to give that opportunity for Dr. Miller to talk about his own research. So we'll be right back with Dr. Scott Miller.
Dr. Foojan Zeine is a psychotherapist, a marriage and family therapist, and a life coach with more than 27 years of experience. She is the author of the Awareness Integration Model, which has been researched and published in numerous international journals. Dr. Foojan has offices in Beverly Hills, Irvine, and Woodland Hills, California, and also consults online and by telephone. Make an appointment with her today by calling 818-648-2140 or go online to www.foojan.com. That's www.foojan.com.
Have you ever wished you could just wake up one day, reach across your nightstand, and hit the life reset button? Let's face it, the struggles and frustrations of everyday life leave millions of women and men around the globe yearning for a new way. And the new way is right here in Life Reset, the awareness integration path to create the life you want, by Dr. Foojan Zeine. You can get it now at foojan.com or amazon.com. Life Reset, the awareness integration path to create the life you want. You deserve it.
Were you recently injured in a car accident? Then you need the law offices of Aria Thadakar for your free case evaluation. Don't let the medical bills pile up, and don't let the insurance companies try to settle your claim for a few $100s. Call 714-464-3246. The law offices of Aria Thadakar serves all of California. If they don't win, you don't pay. So call now, 714-464-3246. This is a paid-for attorney advertisement by the law offices of Aria Thadakar of Orange, California.
Welcome back, everyone, to the Inner Voice Show. I'm excited to have Dr. Scott Miller, who's the founder of the International Center for Clinical Excellence, an international consortium for clinicians, researchers, and educators dedicated to promoting excellence in behavioral health services. Dr. Miller conducts workshops and trainings in the United States and abroad, helping hundreds of agencies and organizations, both public and private, to achieve superior results. He is one of the handful of invited faculty whose work, thinking, and research is featured at the prestigious Evolution of Psychotherapy Conference. His humorous and engaging presentation style and command of the research literature consistently inspires practitioners, administrators, and policymakers to make effective changes in service delivery. Dr. Miller is the author of numerous articles and books, including Escape from Babel, Toward a Unifying Language for Psychotherapy Practice, The Heart and Soul of Change, Delivering What Works in Therapy, Heroic Client, and staying on top and keeping the sand out of our pants. And you can see him and talk to him and contact him through scottdmiller.com. Welcome, Dr. Miller, to my show.
Thanks, Foojan. It's nice to be here. Please call me Scott.
Okay, Scott. I know that I've learned so much from you, and you have created amazing research in the field of psychotherapy for us as psychotherapists to really see what are we doing in sessions. And I always, when I listen to you, I remember the book that I read with Jay Haley, I think, that says we have had hundreds of years of psychotherapy and the world is getting worse. And sometimes I listen to you and I look at what is it that we're doing, and you have found ways of actually looking at that thoroughly and seeing what works and what doesn't. And I looked at your blog, and it says just how good are our theories about the cause and alleviation of mental and emotional suffering. And let's talk about that today.
Okay, sounds good to me.
Go for it.
Well, if the question is how good are our theories at accounting for the causes and cures of the problems that plague humanity, the answer is not very good. At the same time, that doesn't mean that psychological counseling or care doesn't work. Dating all the way back to the 1970s and the first so-called meta-analysis by Mary Smith and Eugene Glass showed that despite the abundance of theories and methods, that all of the approaches worked and worked relatively well. So I think the key for the consumer in approaching mental health services is to find a therapist who speaks a language that makes sense to them. That language may be that you need to change your thinking. It may be that getting in touch with your emotions. It may be some steps to behavioral activation, meaning that you got to get up and take some proactive measures to change your life. Others, insight may work. All of these have the possibility of work, but the crucial ingredients in the formula is, does it speak to you?
So part of what can a person do when they're suffering, whether it's through stress or anxiety or depression or something in their life isn't working? A lot of people look at even going into a coach or a psychotherapy because their relationships aren't working or who they are isn't working. Sure. And at that moment, there's a choice to go and find someone. And you're saying that the part of the research from someone who actually is seeking a psychotherapist is someone whose style talks to you and you feel comfortable with that person. Somebody could be more cognitive or emotional or behavioral or straight and frank, confrontational, and someone can be taking care of you and saying, just validating you no matter what. But there is a part that really supports your way of being, and finding that is the first key.
Yeah, and I think that can be really challenging, and it's why I think so many of us struggle on our own for so long. By the time somebody actually reaches out to speak to somebody, they've often had the problem for years, and they would have benefited had they been able to get in to see somebody. And so the good news is as well that most treatment that's done in the United States is of relatively brief duration. And when I say brief, we're not talking about years here. We're talking about, for most people, a handful of visits, on average between 8 and 12, and a significant percentage of the people who go are going to experience significant improvement in their well-being or relief of their symptoms. I think the key here to start out with, if you're looking for somebody, is to pick up the phone, call several, and ask if you can spend 10 minutes with some very well-honed questions. Think about yourself, what you're looking for, what you might need, and see if the therapist feels like it's a good fit. If a therapist won't speak to you at all, then I say move on, because therapists are all over the place nowadays, and you can have your choice. Don't necessarily go just to the person that your GP refers you to. Don't necessarily make your first choice taking a drug. There's nothing wrong with that. The problem is most people in the United States, at least, make their first contact about a mental health issue or concern with their primary care physician. The primary care physician, rather than saying, here, go speak to my colleague who will talk with you, might instead be tempted to take out their prescription pad and write a script. When people are asked, would you rather talk about your problem or take a drug, close to 80% of them say, I'd like to talk it through. And after all, that's what we do with our families, with our aunts and uncles and close colleagues and friends. We try to talk it out. But sometimes you need extra expertise and also the security of knowing that what I'm telling this particular person won't travel beyond their doors. And so, again, the first step, I think, would be think of some solid questions that you can ask and tell the person about you. Don't limit that just to the nature of your problem, because all therapists can treat depression, all therapists can treat anxiety, or at least most. And then the second thing that you want to do after you've interviewed them is try them out. And you might want to see 4 or 5 visits and see, is anything happening? If something is not happening, this again is something you should speak directly to the therapist about, because most of the research indicates that people begin to experience benefits sooner rather than later. And it doesn't mean either that you have to stay until you're all done. Lots of people need a jump start, and that's perfectly fine to seek out a therapist just for that. Recharge your batteries, get going on your own problem-solving efforts outside of seeing that particular therapist.
Scott, you talked about 8 to 12 sessions. I've definitely had the same experience as you were talking about, but there's also something else that came up for me as an experience, and I wanted to share with you and get your opinion about it. I don't know if it was more the chicken or the egg. Was it that first the insurances said brief therapy works, so we're willing to pay only up to 12, and then the authorizations had to come, and therefore the culture of psychotherapy became more brief therapy versus the culture being more of an intense, long-term therapies? Or is it also a culture depending on location? For example, I've done psychotherapy in Los Angeles. I've done psychotherapy in the north part of Los Angeles. I also opened up an office in Irvine, Orange County. I moved to Northern California, and I was a therapist there. And it's also interesting for me that the culture of the subsection of the city and the group that are coming also has something to do, whether everybody thinks, oh, I'm going to therapy because this is something I want to do for years to take care of myself, or other locations see this as a medical model. As you said, they go to their GP, so they also treat psychotherapy from a medical perspective. So they're waiting to go to the doctor, get the first symptomology done and over with, and then don't need a therapist anymore. I've also seen this culture going around, which, New York has the culture of psychotherapy for years and years and years for people just to go to therapy. What do you think about the medical model versus other cultures around going to therapy?
I think that all of those things that you've just mentioned can affect treatment length. Mm-hmm. It can also affect the type of treatment. Certainly, people propinquity, where you live and the nearness to the various providers, is going to determine what kind of therapy that you're offered, what you're going to be exposed to. At the same time, going all the way back to the 1940s, when the government first started gathering healthcare statistics, the number of visits to mental health care professionals has always been relatively short in duration. When people ask me as therapists or as clients, what do you think, long-term or short-term therapy? I always screw up my eyes or nose in a way because I don't really understand that question. No one would go to the surgeon, and the surgeon wouldn't say to them, would you like the long surgery or the short one? It seems nuts, really, that kind of question. And yet in psychotherapy, this is kind of a common view amongst therapists, and that can trickle down to clients' questions and concerns as well. The real question is it helping you?
Yeah.
So utilization patterns do vary, but what we know is about optimal use of treatment, and that is within the first 5 to 6 visits, you should feel like you're getting back on your feet with that particular therapist. Right. Does that mean all better, all done? Heavens no. For some people, it means they're done enough for now. and they can leave. With those folks, I like to think of a therapist the same way we think about a dentist.
Mm-hmm.
When you go to see your dentist, they clean your teeth, they may do a crown or fix a cavity. Does that mean you never go back again? Is that the cure, the sign of success? Well, heavens no. You're going to go back routinely throughout your lifespan for additional visits and checkups. I wish we had this attitude about therapy. I still feel like we're under the medical umbrella sometimes in a surgical model, that what you do is you have a problem, you go to the therapist, they cut it out, and success is measured by whether or not you ever need to go back. That's kind of crazy. No dentist would say that.
Right.
So the most common utilization really is throughout the life cycle with people who've given it a go, to go back here and then, especially if they've had a successful experience, and have a tune-up and a checkup. At the same time, as I said, if you're going right now and you're not seeing some benefit by the fifth or sixth visit, you probably should talk to your provider and ask, what can we do different? If you've been going 2 to 3 months and there's no change in your condition, then is the time to get an external consultation, a second opinion. That may seem to violate some sacred unspoken rule, but the truth is that's what happens in healthcare in general. You see your physician, they don't help you, they try something different, that doesn't help you, well, then the physician might suggest a second opinion. Whether or not people need to go for years and years every week, we have so little data about that because, Foojan, it is so statistically rare. Mm-hmm. So we really don't know. We don't know. And what would my personal opinion be? It's always nice to have somebody to check in with, a consultant. But at the same time, maybe it's an indication that there should be additional social supports in your life that are absent. That we'd have to take on a case-by-case basis because, as I say, the evidence is so very thin.
I really enjoy what you just said because I think that I've also experienced the past 27 years where people come in with some sort of a symptomology, and within the first, like you said, 6, 8 sessions, even 4 sessions sometimes, whether they're couple or individual, they see a particular shift, and that symptomology might shift, or at least they see the cause roots of it, and they become aware of that or the insight of that. And then it might take another, depending whether they choose to stay in therapy, to go over the causes and shift behaviorally and all of that. Then they will handle that. But then there are also people who choose to have the space of clear listening where they're not going to find it anywhere else, where they can talk into the space of clear listening and constantly create more of who they are. That I've seen that it handles for, maybe a couple of years. And then I've seen, and I have clients who, like you said, they have monthly tune-ups where it's a proactive concept of them liking, whether there's an issue or not. Again, it's that empathic and an open listening where they talk out loud about every aspect of their life to see if they can be proactive about something that's coming up. And that is the model of being like the proactive part, as you said, about the dentist doing the checkup. And those people, it seems like their life appears to be more functional because they're more aware of what's going on with them as if they ever attempted to come to therapy. There's this part of psychotherapy that also shifts from sometimes the medical model of cleaning up something or treating some aspect of life. And then there are also aspects of psychotherapy that maybe also goes with life coaching, which is just phase of life issues that people generate from one phase of life to another, the anxiety that comes up, the grief that comes up. And that might be different completely from a treatment model that there's a mental illness going on and they have to handle that. What are your thoughts about that?
Well, I think that, again, the evidence about personal growth from psychotherapy is very, very limited. the evidence regarding coaching is also limited. Now, neither of those statements means that those things can't help, but my bias would be to say that in those instances, the goals need to be very carefully defined. And here's why. Psychotherapy comes with a risk. Anything that's effective has to come with a risk, otherwise it's snake oil. Let me say it again. Anybody who says that it's all an upside is selling you snake oil or something that has no effect whatsoever, because everything has potential side effects, and psychotherapy is no different. 10% of people on average over the last 40 years of research are worse off at the end of treatment than they are at the beginning. This is something that I always inform people of when we start our work, but I also promise that we're going to use a standard measurement tool to assess on an ongoing basis whether or not they're making progress. And in the event, although it's statistically rare, about 1 out of 10, that something begins to deteriorate, well, then we're on top of it and we know it. So as long as you are setting a specific goal, you have measurable objectives that you're trying to reach in terms of personal growth, and there is some check and balance on deterioration, then I think that you as a consumer of mental health services are going to be in far better stead. And as I say, the research really in that area is really thin.
I've worked with your tools for many years, and I've had my whole agency use the tools. One of the things that I loved about it is the respect that the clients have, the person has, in being a participant in the outcome. And I've watched it happen both ways. One is keeping themselves accountable, being more working toward the treatment goals, and or being more aware that if it's not happening, what is even their part in it, what they have done during the week to work through some of this, maybe the homework or conversations that they've had, and then having the potential conversation of sharing that with their therapist, and then their therapist also being in the space of not coming up with justifications of why things are working or not. I mean, I myself, the same as a lot of other therapists, have gone to the space of whether I see a minute change in someone, and because their expectation is different from the outcome, that they will angrily say, I've come so far and nothing has changed. And then I would have to go and specifically tell them how much it has changed. And then they'll look at me like, yeah, but I'm expecting something else. And then it's the opportunity to come to terms with the treatment goals if we are in the same room and working through the same thing. If we have different goals and if we're looking at things in a different way, obviously it might not be working. So it's a potential space for the two of us to get aligned. And the tools you've offered to the psychotherapy world really facilitates this type of assumptions and projections that happens inside in the relationship between the person who's coming to therapy, to bring it into some form of reality base which can be agreed upon for both.
Next to perhaps having a personal shopper or someone who is tailoring your clothes to fit you, psychotherapy is the most customer service driven experience possible. Mm-hmm. We're really trying to make sure that what we do fits and helps you. And that means there has to be feedback from the consumer to the therapist. So something that we know from the research literature that can be a bit scary is that the outcomes of psychotherapy have remained relatively flat for nearly 4 decades. Now, that being said, it's important to note that they were pretty good all along. Psychotherapy has the same effect size as coronary artery bypass surgery, and yet the outcomes haven't improved, and it doesn't appear that therapist effectiveness improves over time, despite their spending tons of time and spend money on continuing education. So this means that we have to tailor our professional development opportunities by seeking feedback from the consumers who are going to, in the process, point out where our blind spots and shortcomings are. And you've highlighted one of them, and I love your particular example. It's so transparent, and that is you're telling the client, wait a minute, you have changed in this area, X, Y, and Z. And they're saying, well, yeah, but I want A, B, and C. It's classic.
Yeah.
It's nice that they got X, Y, and Z, but until they get A, B, and C, they're not going to be happy with you and your work. That means in some ways I'm going to have to decide, is that within my wheelhouse to produce A, B, and C? Secondly, do I want to? And third, am I willing to be led by the person into the areas that they might want to go? So I think that's a particularly good example of how we can improve as providers. And I'll also say that the therapists that I meet, and as you mentioned at the beginning, I spend my life on the road doing teaching and training and research. I love being a member of this profession. And the reason is I meet therapists every week that are so dedicated to their craft and to the people they work with. These tools that our team has made available, an outcome measurement scale and a process or a session rating scale, are just helpful adjuncts trying to provide therapists with a structure or scaffolding to better connect with the clients, and especially those clients that they might miss if they didn't have those tools.
So as we're talking to the listeners who might be in therapy or might assess that they actually would like to go or need to go for some treatment, the first tool that you gave them was connect. If you go, connect with to see who connects with you, stay with them a couple of weeks or sessions and see if it's working for you. And so other tools that as the treatment goes on, what is it that our listeners can be more productive as far as they're concerned to utilize the psychotherapy as the best of their capacity? Yes, they're going to a professional, and the professional is supposed to be an expert and do their job. But as a participant and someone who has high stake at getting better, they're they're putting their time, they're putting their money. It's to them who's suffering, and they really want to go to therapy and release the suffering. If they were also a responsible and an accountable part of this relationship, whether they're going for an individual or a couple, what would you suggest, based on all the research that you have had, that they could utilize this space in the best of their capacity?
Well, I tend to see things in interactional, relational terms. And so I find that question a little challenging to answer. But I will say this, that I appreciate the clients who are assessing along with me and transparently how engaged they are with me. That they let me know, do they feel understood when I speak? That they let me know whether or not we're talking about what they wanted to talk about, wanted to work on. That they let me know whether the approach, the method, the way we're working together it makes sense. I have lots of stories that therapists who give homework assignments, for example, the client dutifully nods, and at the same time they're nodding, they're thinking, I'm not going to do it.
Mm-hmm.
Now, I guess we could ask the question, whose fault is that?
Mm-hmm.
And my response to that is sort of wrong question.
Mm-hmm.
No homework assignment is either good or bad until we know if it worked or not. Well, if the client hasn't done it, then it didn't work. So I'm hoping that my clients will speak up, because I'm not the repository of wisdom. I have lots of ideas, and saying they're going to do a homework assignment when they really aren't going to do it, or it didn't happen to make sense, they couldn't figure out how to make it work, or they just didn't have faith that would make any difference. That's stuff I want to know. Or that when I speak, for example, I'm absolutely convinced by my own words, but the people I work with aren't always convinced. by it, I'd like to know. I'd like them to speak up about it. The more that they can engage with me around that, give me feedback, the more productive our working relationship often is. At the same time, it's incumbent upon the provider, the helper, to ask as well, is this making a difference in your life? And of course, as you know, because you've mentioned the tools, we think you should do that formally at the outset of every visit, having people rate, how are they doing individually? How are their relationships? How are things socially outside of the home? And then using that information to guide whether they continue with more of the same focus in the therapy, or in the event that the scores are not changing, then we can alter the direction that we're going. So I'm hoping that might have gotten at your question a bit.
Yes. The part that I'm also hearing from you is that when a client, someone who's going to therapy, decides that I'm going to be vocal about my perception, about my needs, about my desire, about if I don't understand something, to to respect myself and say it out loud, to feel safe enough to be able to say what my needs are toward the therapist. And that really helps the interaction between them. And this does not alleviate or take away from the responsibility of an expert. But a lot of the times it's who I am. I know, for example, also I've referred a lot of people to psychiatrists in order to have medical management. And part of what I've always asked the people to do is please, please, please be clear. Even jot down, write down exactly what it is, because sometimes when we go there, we're so much into our own issues and we forget to say all of it, because this is the only field that the experts only have to rely on a subjective narration of what's going on. And we're a field that we don't have the blood tests or urine tests or MRIs or, all of these CAT scans in order to find out, regardless of what the patient says, that we have those tools to look at. Like a patient might say, hello, I'm doing great. And the doctor says, well, I'm sorry, your cholesterol is so high and, you're going to be diabetic. And no, I don't have any symptoms. We're like, well, it shows here, like, you're a blood test plus what your narration is. And in our field, what the subjective experience of the client is and the objective, symptomology that happens, it is so important. So, as I heard you say, is it really works when the person who goes and seeks help to give themselves the right and the respect to ask for it, talk about it. If something is not working for them, to state it to the therapist. I remember when I was doing, and a lot of my therapists in our center were doing the measurement tools, when it was about, and part of it was also cultural, because the cultures, the inner cultures that we were seeing, they're also very polite, and they don't want to upset anybody. So these measurements at the beginning of the treatment were all coming as, that they were evaluating the therapist, and they wanted to be nice to the therapist, and they wanted to be like this was an authority, that they needed to be submissive toward the authority. So it was more of talking and finally for them to get how useful it was, that if something did not work for them in the therapy, or whether it was an approach or a tonality, or they weren't feeling safe, or there was a confrontation which didn't sit well with them, any of it was not necessarily working for them, and they wouldn't say it. And I know as a therapist, it works for me when my clients say to me what their needs are.
Right. And, if you don't feel, if you somehow lose your voice in that process, well, that may be a sign as well. If you feel not capable of speaking up or speaking out, then it may well be you've sensed correctly that your feedback wouldn't be welcome, in which case it might be best to cut your losses and go to see somebody else instead, rather than persisting. So I'm hopeful that people, and I personally think it's wonderful when people speak up and speak out. Doesn't mean I can always accommodate what they are saying or asking, but then as the professional, I'm working to try to point them in a direction where they might find someone or something that's more helpful and useful in the process. I want to go back and say one thing you'd mentioned, because you mentioned the medical model. And let me give you a corollary, because I know you're not implying this, but I don't think everything is roses and moonbeams in the field of medicine. Physicians write out millions of scripts yearly in the United States. Now, don't quote me on this exact figure. You can probably find it on the net and then add it to the presentation later. But I think something like 50% or more of those scripts are never filled.
Yeah.
Now, what does that mean? Does it mean people don't want drugs? Nah, I don't think so. What it does mean for sure is that an intervention was wasted and the time was wasted. Here's a physician and a patient who talked with one another. A decision was made that a drug might help. They were given that prescription and they never fill it. I guess we could attribute the client laziness. That's not a very satisfying solution either.
Right.
So what is it? And the truth of the matter is that it just didn't work. And we should be looking at the mismatch between the intervention that was given and the engagement with that intervention on the part of the consumer, if we're ever going to get any better at it. So we know when we should write a script, or if something else should have been done in its place. So I think our errors are, rather than locating the blame in us or them, the errors can be a real source of education if we take a look at them and do a postmortem and try to figure out why did that happen. And when we do that, it turns out that quite often there's a problem in the working relationship. There was a misunderstanding, as you were saying just moments ago, in what the person actually wanted, in the approach or in feeling understood or not. And I know myself, I have been one of those patients who's had a script written by the physician and I've never gone to fill it.
The question that comes up for me a lot is, how come we have had so many theories, so many dedicated people in the field that are working to alleviate suffering for the clients? There are clients who are very motivated in alleviating the suffering. And yet the ratio of depression and anxiety, not only just major depression and general anxiety, but everything that also elevates from them, it's getting higher and higher in percentage. What is your opinion about that?
Well, I think there's actually two questions there. One question is, why do we have so many theories? And the second question and observation, which I find myself puzzling over at present, is the rising rates of mental and emotional struggle in our culture, despite the widespread availability of both talk therapy and medication. So let's take the first one first. And this isn't an area that I would consider myself any kind of knowledgeable expert. I'm a researcher, in other words, a bean counter. I'm more inclined to count the number of sessions that people attend and what's done in those sessions and categorize it, and to do more philosophical reflection about why we are the way we are. But somebody who has done a lot of thinking about that is Fancher, F-A-N-C-H-E-R, who's written a fabulous book that doesn't get read enough, in my opinion, called Cultures of Healing. And in that book, he makes the argument that we continue to talk about talk therapy as if it is the psychological equivalent of an antibiotic. Mm-hmm. You know, you have a bacterial infection, they write a script and it kills it. It doesn't matter whether the physician comes from America or Sweden or Latin America. That physician gives you that drug. It doesn't matter if they are someone of Christian faith or a Muslim. It doesn't matter. They give the drug, it's going to help. But in psychotherapy, cultural and contextual variables are very important. Why? Because psychologists and psychotherapists do not have a corner, nor did they invent healing of mental and emotional suffering. There were many other people involved long before we were that were involved in this process we call healing. Or for me, what that word means is being near people, being near suffering. And those explanations that tell us why and offer relief tend to fit with the cultural context in which they occurred. Is it really any surprise? I can hear Bob Fancher saying, is it really any surprise that cognitive therapy is popular at the present? I think he'd say no, because we have the most literate population in the history of humankind.
Mm-hmm.
How have we all been trained to solve our problems? You have to think about them.
Right.
That is, in a larger cultural vein, why the current climate is so strange and I think disconcerting to people, because we're highly literate, but we don't seem to be doing a lot of thinking at the present time. So I would say that there is a mismatch between the paradigm that psychotherapy works and the one that actually we prefer to think of psychotherapy as. We prefer to think of it as a medical intervention, when really it's our current culture's way of thinking about solving mental and emotional suffering.
And therefore, that's why it changes, right? So that's why if the culture changes, then the modalities and theories would keep changing due to the culture.
Yes, and you don't have to look very far. And Bob's book is really phenomenal about this. But during the industrial era, what theories were popular? Behavioral theory.
Behaviorals, yeah.
Right now, what's the big popular theory? Neuroscience theory.
Right.
Why? Because for the first time we can peer inside the head without cracking it open. We can take PET scans. And suddenly now everything is within the brain. When you step back and look at it this way, it's almost comical, which is why I said at the beginning of our conversation that you have to find a narrative that appeals to you, because that's what keeps us going. We're a human eusocial species. We live in story and community. So you need to find a story and a community that makes sense and provides direction to you. Saying that doesn't take anything away from it. How do we know that? Look at how potent identity is. It drives almost everything. So find something that fits for you. Connect with that. Connect with that community and the way that they offer in terms of structures for achieving happiness and success.
I've also sensed that a lot of what psychotherapy has done, regardless of the theory, and you have a blog on this and you talk a lot about this, is the relationship that is in between the people and the empathy that gets created, where the person gets that they can accept themselves, they can manage themselves, they can be with themselves within the construct of the empathy and this empathic listening and being that is inside the room with them, for them to see themselves. And I also see this many times in the world of psychotherapy, and then / the spiritual and the coaching world, where sometimes all of this kind of blur the edges, where the person is finding somehow to find that relief inside of, find some skills to find the relief among themselves, which comes a lot with that kind of an accepting of self and then others. What are your thoughts about these blurred edges of between psychotherapy, the spiritual world, the coaching world, the self-development and progression, world, and classes and seminars and all of that?
Well, I think that's peculiarly American.
Mm-hmm.
In terms of this whole focus on self and development. I'm probably going to sound too critical if I talk much more.
Go ahead.
Because I'm really just I'm really just a researcher. But I will say, for example, that I've never seen the idea of mindfulness so ruined from its Buddhist origins as it has been here in America, where the exact opposite of what mindfulness was supposed to achieve is now the primary goal, and that is to focus on the self.
Mm-hmm.
Meditation has always been about something other than that until it came to America, and then it was incorporated within America's unique culture, which, again, I think speaks to Bob Fancher's point in it. So, yeah, I think that's what I would say.
What you just said is very interesting because I also work with different cultures, and it's interesting that the individualistic aspect of look at myself and satisfy myself and be free and clear. When it comes into the room, into a family systems that are not from this culture, and their culture is not individualistic, and their existence and identity is really related to the family system itself, and sometimes to the family name even, and the heritage that comes with it, then this concept of individualism becomes shocking, and it becomes very confusing for the person to it appears that in a Western world, health means taking care of me and separating and creating that distance and space, versus in other cultures, that type of a distance does not make sense, and it's the whole system is not set up for that. So then sometimes it creates more havoc.
Right, and there's two things I think our field can learn about that. First off, psychotherapy, as is presently understood and constituted, is a late arrival to the healing game.
Right.
There are cultures that have healing traditions that date back millennia. So there's a lot we can learn, and I find therapists very interested and willing to learn that, and they're going to take on the cultural trappings of wherever they happen to be adopted. We also know from the research that clients want to talk about the differences in culture. They want to help the therapist be informed, and they appreciate not only the transparency, but when therapists understand those cultural differences and utilize them in the helping process. And here again, I think that although the professional organizations have been advocating and had official policies about this for more than 30 years, the field is really just catching up about what does that look like in the real world of clinical practice. Very exciting research being done, for example, by Jesse Owen and others at the University of Denver on this very subject. If you just Google his name, Jesse Owen, and culture and psychotherapy, I'm sure multiple articles will show up that speak to the evidence base about the importance of that.
Thank you so much. I really appreciate what you're doing for our field of psychotherapy, bringing it into space of clarity for many of us as therapists who have used your tools in the office, and supporting the clients who come in to have a voice, to be a part of the measurement tools that are happening about who they are. And that has really created a hell of a lot of high respect into the system of psychotherapy, as I've known it, as I've taught other therapists and my own field. So thank you again for what you're doing and creating and moving along to create excellence in our field.
You're welcome. And for me, it's been a fun ride the entire time up to this point, and I look forward to the years ahead.
And thank you for being with us today. And for all of you who are listening, I hope that you create the respect for yourself, to know that you deserve to have an amazing life at any point in life that you know that you are suffering for any reason. Get help. Get help from whomever you think that works for you, the same way that Dr. Scott Miller was talking about it. Get help. Open your hand and receive what is out there, the skills that are out there, because we only have one life to live, and I think we're responsible to live it in the utmost level of beauty and happiness and fulfillment, whatever you call happiness and fulfillment, not anybody else's definition of it. But with all the suffering that can be out there, how can someone be at ease with what's going on within themselves, within their system and family, and that whether you take care of yourself or not, you have an impact in the world. So whether you take it or not, you have an impact in the world. So create an amazing life for yourself and everyone around you. You deserve to have it, and everyone around you deserves to have you and the best of you. Until next week, take good care of yourself. Bye-bye.
You're listening to The Inner Voice with Dr. Foojan Zeine, only on LA Talk Radio.